Okay, this is number 3. The reason I stop frequently is that YouTube only lets me post in 10-minute intervals. And if I go over that, then I have to edit the video and it's a hassle. So anyway, better to be short than too long. Biliary atresia complications. The most common complication associated with the CASI procedure is ascending cholangitis. If you can imagine, you've attached the intestine to the liver. So ascending cholangitis is a bacterial infection of the biliary tree. Bacteria that you normally find in your small intestine moves up the Roux-en-Y, causing infection. Your signs can be an unexplained fever, increase in jaundice, lighter stools. The child will get IV and then long-term oral antibiotics to treat and prevent the ascending cholangitis. Formation of scar tissue eventually does lead to portal hypertension in many of these children. Portal hypertension is that increased pressure in the veins between the intestine and the spleen to the liver. We've talked about that when we talked about adult cirrhosis. Complications will include problems with bleeding and clotting, weak veins in the esophagus and stomach, ascites. When these complications can't be treated, then the child has to have a liver transplant. When bile flow is only partly restored by surgery, the complications of cirrhosis will develop gradually. If the CASI procedure is successful in draining the liver and returning the bilirubin back to normal, the children can live many years with normal growth. Some will grow into adulthood, and some may never need a transplant, but most children do require transplantation. Most often, even though the surgery is successful, that slow progressive damage continues and transplantation is needed. Pediatric liver transplantation has become very successful, and it really is the only significant hope for children born with biliary atresia. Partial liver transplants from living donor resections are now possible, which allows the transplantation to occur when the child is in optimal health, rather than waiting until a liver cadaver is available. Your first-year survival rates are very high. You know what? That's all that I want to do. I will load these and send out an email. Catch you later.